Next, we move on to the Coombs test. For the first part is direct Coombs test. Before that, we have to know the example of the disease that give positive direct Coombs test. For the first one is alloimmune hemolysis, which include hemolytic disease of the newborn and alloimmune hemolytic transfusion reaction. For the next one is autoimmune hemolysis, which include warm antibody autoimmune hemolytic anemia and also cold antibody immunohemolytic anemia. And for the next one is drug-induced immune-mediated hemolysis, which include methyl-dopa, penicillin, and quinidine. The step involved for the first one is blood sample is obtained from patient of immune-mediated hemolytic anemia, and we have to wash 3 times with the normal saline. And then we have to add 2 drops of Coombs reagent and then centrifuge at 1500 rpm for 1 minute. And then we have to resuspend the cells and examine the macroscopy as well as the microscopy. The positive test result include the RBC agglutination. We move on to the second part, which is indirect Coombs test. Before that, we have to know the example of clinical use of indirect Coombs test. For the first one is blood transfusion preparation, which include antibody screening and also cross-matching. And for the next one is antenatal antibody screening, which to screen pregnant women of IgG antibody that are likely to pass through the placenta into the fetal blood and cause hemolytic disease of newborn. We proceed to the step involved. For the first one, we have to incubate the patient's serum or known serum, which added with donor red cell. And then the antigen and antibody complex form. And then we have to wash the cell with 3 times in normal saline to remove the excess serum with no free antibody. And then we have to add 2 drops of Coombs reagent, keep for 5 minutes, and then centrifuge at 1500 rpm for 1 minute. And then we have to resuspend the cell and examine the macroscopy as well as the microscopy. The positive test result indicate when there is an agglutination of the red blood cell.